So once we suspect that a patient could have oral cavity cancer, we do certain tests to arrive at the diagnosis. So initially we take a good history from the patient, then we do oral cavity examination. After that, the patient is subjected to indirect laryngoscopy or ideal. Basically, ideal is nothing but a small mirror is inserted into the oral cavity to see the structures that are behind the tongue that we cannot see directly. So we visualize the posterior extent or back of the tongue. We visualize the throat to see if any cancers has spread till there. After that, a patient is sent for a biopsy. Biopsy is nothing but a small piece of the tumor is taken and sent it to pathology lab where they give us the report in which the type of cancer, the grade of cancer, etc. are mentioned. The patient is also subjected to radiological tests, including CT scan, MRI, or PET CT. So in CT scan, mainly we see the extent of the tumor, whether any lymph nodes are involved, whether any bony structures are involved, the how much the tumor is invading inside. Because from the naked eye, we cannot see how much the tumor is invading inside the skin or inside the body. So to see all that, a CT scan is done. In some cases, such as carcinoma of the tongue or floor of mouth, where muscular structures are involved, a MRI is usually done because that gives a better resolution over CT scan. Sometimes a PET CT is also done. The advantage of PET CT is not only the primary structures, PET CT will scan the entire body. So in those cases, if there is any metastasis to any other part of the body, can also be picked up. If PET CT is not done, we usually tell the patient to get a chest X-ray to see if there are any lung metastasis and a ultrasound abdomen to rule out any liver metastasis. Apart from these routine blood tests such as complete blood count, hemoglobin, platelet, renal function, and liver function are also done. This is both for treatment purpose or also for certain other tests purpose. So these are all the investigations that is usually done in a suspected case of oral cavity cancer to help us and to arrive us at the diagnosis and staging of the disease.